welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. The primary difference between health and wellness is that health is the goal and wellness is the active process of achieving it. You truly cannot have health without first achieving wellness. Our lives have become more sedentary than ever 1 year into the pandemic, and long working hours, sedentary lifestyles, poor food choices and lack of physical activity are all factors that contribute to a variety of lifestyle disorders including obesity, diabetes, hypertension and heart disease. Now, diabetes comes in all shapes and sizes. Like many other diseases, it isn't one to discriminate. Diabetes management requires awareness. Diabetes self-management training and education plays a vital role in managing the disease, and there are many misconceptions about diabetes management. If you're suffering from diabetes or one of your loved ones are, the right knowledge can help you control it better, and we have with us experts to give us that guidance. We're joined by Dr. Thulasi, a consultant diabetologist, Thulasi Hospital, Salem, Tamil Nadu, and Dr. Moazam, senior consultant physician and diabetologist, Sunshine Hospitals, Hyderabad, and Dr. Moazam's Diabetes Care, Hyderabad. Thank you so much, doctors, for taking time out and joining us on the program today. Dr. Moazam, I'd like to start with you. And type 1 diabetes and type 2 diabetes are two different types of the disease, each with a different mechanism. Even the age of onset is different. Are the symptoms similar for both of them?
Ma'am, actually, thank you so much for having me on board, and wonderful initiative. The most important thing is that it's imperative to understand what type 1 and type 2 diabetes are. Then we'll be able to elucidate what the actual complaints and the symptoms and signs which we'll be able to catch at an early time. So type 1 diabetes, basically it's a cell-mediated autoimmune pathological destruction of the beta pancreatic cells which produces insulin. So there is total destruction of the cells. So the end result, there is no insulin or very low insulin. Which age does it happen? This has a bimodal pattern. If you look at the age from 4 to 6 years, then it peaks again from 10 to 14 years. But it has also been reported in people coming up to 30 years of age, type 1. So the end result, no insulin. So the main purpose of this to understand is what is ramifications in terms of managing this disease. For instance, what are the early signs and symptoms? It's very difficult in a child to understand a child with type 1 diabetes to identify, because global consensus says that 4 out of 5 parents cannot appreciate the symptoms of diabetes. So it's very difficult in type 1 diabetes. But nonetheless, there are certain alerts which the parents should be aware of, because most of the time, the children are not able to speak for themselves as what's happening with them. The most common symptom which everybody has is globally is that they have this excessive thirst, excessive hunger, and excessive appetite. But in addition to that, you need to remember that the children who are bedwetting, this one particular sign that can warn the parents to get aware of this and get the child, investigated. And then the child is not very active. He's not like any other children who are playing around. He doesn't play around. He plays a little bit and he feels very fatigued. So these are two such early signs along with the other symptoms which I already mentioned. Now coming to the type 2 diabetes. Type 2 diabetes is a multi-organ disease. It's a chronic insulin resistance and chronic insulin resistance leading to hyperinsulinemia. So this is what causes more of insulin to be left in the body, therein by increasing your weight, and at the same time allowing the livers to produce more amount of fatty cells and causing more of insulin resistance, because more amount of fat is getting accumulated around your belly, and that's why we call the apple-shaped bellies. So these are the age group of 40 years and above. These are the people who can get type 2 diabetes 40 years and above. But how early can we catch them? Because the symptoms are same as it is here. 50% of the cells are working, 50% of the cells are not working. So this is the non-insulin type of diabetes. But in addition to that, there are early signs which your body speaks well in advance. For example, if you look at the wrist of your hand, you find a broken necklace lying like this. You see this?
Right.
You see this? Yeah. This is the same thing can be found at the nape of your neck. This is a first telltale sign that your body is telling that your insulin is not being used properly. Before the actual diabetes happens, there's a phase called the pre-diabetic phase, which is actually missed. This pre-diabetic phase lasts for almost 6 years. Diabetes just doesn't happen. Type 2 diabetes just doesn't happen in a day or two. So it is imperative that when you look at these signs, your body speaks well in advance to say that you are going to get diabetes in the future. The risk is high. So this is one such sign which is called as acanthosis nigricans.
All right, so very interesting there, doctor, all these, sort of signs, especially for parents of children who may have diabetes, a way to read those signs that they could be suffering from the disease. Dr. Thulasi, is there any correlation between a baby's birth weight and the possibility of developing type 2 diabetes? And what precautions can pregnant women take to avoid this?
Yes, first of all, good afternoon to everyone. Yes, the answer to your question is baby's birth weight and type 2 diabetes have a definite U-shaped relationship. That is, both low birth weight and high birth weight babies are at risk to turn diabetic in adulthood. Low birth weight babies being deprived of nutrition when they grow up in mother's womb tend to store enormous glucose and fat in their body in order to catch up. In turn, they gain weight in their middle age and develop diabetes. And likewise, high birth weight babies are also equally at risk. So what are the precautions that the pregnant woman can take to avoid this? Best prenatal and antenatal care is the crucial aspect for this to avoid low birth weight and high birth weight babies. So when they come for prenatal and antenatal checkup, what we do is generally we assess their general well-being and other screening for other medical illnesses like diabetes, hypertension before pregnancy and during pregnancy, and of course we'll assess their nutritional status and the status of physical activity. So putting all together, we will guide them and take measures accordingly so that we'll help them to go through a smooth pregnancy and achieve the target weight. That is, the ideal weight gain throughout pregnancy should be in the range of 10 to 12.5, not more or less. So we'll help them to achieve this weight gain and deliver a normal weight healthy babies.
All right, interesting there. Now, Dr. Moazam, are the targeted glucose levels for diabetes management different for different age groups, and does the presence of diabetes complications and other comorbid conditions affect these target levels?
Ma'am, the global consensus is that all over the world target to treat is the HbA1c. This is the glycosylated hemoglobin. It is a metabolic memory. It tells you how well your sugars have been controlled in a span of 2 to 3 months, because the life of the cell of the RBC is only 120 days. So the glycosylation will remain to that effect only. Unfortunately, people get it done every week, every month. So it's not there because the life itself is around 120 days. So you need to repeat it only once in 2 months or maximum 3 months. So that's what the indication are. The American Diabetic Association has set a target of less than 7%. This HbA1c is also used to determine whether the patient is suffering from pre-diabetic or not. So for example, if they have a HbA1c from 5.6 to 6.4, then they are in pre-diabetic stage. If they are crossing 6.5, for all Asian Indian descents, we are diabetic. So we need to take this cue. Of course, the special category of people whom the target levels have to be very careful, especially the pregnant woman, the children, and the elderly people. And also, there were a lot of studies that were done where, especially for the type 1 diabetes patients, where strict control is definitely required to prevent them from developing complications, but it's always at the risk of developing hypoglycemia. So we need to be careful on that front too. And there are people who have been frequently having episodes of hypoglycemia. So those people also, we need to be cautious in setting targets for them. See, the elderly people, the American Diabetic Association has set a different target as to the young. They have given the elderly above 50 years of age to 7.5%. So it is significant from that point of view that the elderly people need not be treated like the young people because of the hypoglycemia. If hypoglycemia is persistent, you see, there are people who can develop complications. There was a VAT study done. Abruptly, the VAT study was stopped basically because they tried to follow the same stringent rule of bringing the sugars down drastically as they did to the young people in type 1. And so they tried the same thing to the type 2 elderly people. And unfortunately, many people died in that study. So it was validated that, we keep a different target for the elderly. So the HbA1c was brought to around 7.5%.
All right. Now, Dr. Thulasi, how does obesity then affect the developing type 2 diabetes mellitus? At what BMI does the risk for type 2 diabetes mellitus increase?
Yes, obesity has got a strong association with diabetes, especially type 2 diabetes. In fact, one of the studies showed that more than 80% of the people with diabetes are attributed to obesity. So when we talk about obesity, in particular about central obesity, that is, in simpler terms, larger waistline will cause what is called insulin resistance. So this will block the action of insulin in our body so that the blood sugar level goes up and people develop diabetes. To add more, we do have, because of this larger waistline and adding up high blood glucose level, high cholesterol and high blood pressure can lead to what is called metabolic syndrome, and that in turn can lead to higher prevalence of heart diseases like myocardial infarction, that is heart attack, and stroke as well. So we should be watchful. So answering to your next question, that is at what BMI, that is body mass index, the person is at risk for developing diabetes. Unfortunately, in Indian population, it has been found that even at lower BMI, we Indians are more at risk for developing diabetes because of increased prevalence of central adiposity, that is larger waistline. So overweight, that is the BMI of 23 to 25, and obese, that is more than 25 BMI, these people are at risk for developing diabetes, which is in contrast to our counterparts, because in UK, obesity, we call them obese only if the BMI is more than 30. So even at lower BMI, that is even at 23 BMI, we are at risk because of increased central adiposity. We should keep that in our mind.
All right, so that's important to track, those numbers and especially your weight. Now, Dr. Moazam, is it normal for blood sugars to fluctuate through the day depending on, the food that we're ingesting or medications we're on? But if you have diabetes, your sugar levels can go beyond their normal range, which can be harmful. If you could explain to us, what is insulin shock and diabetic coma? How serious are these conditions?
See, basically we need to understand that the fluctuations are well documented in an individual who is suffering from type 2 diabetes and type 1. See, it all depends upon how your sleep pattern is, how your eating pattern is, and amount of stress you have, sedentary lifestyle, and skipping the medications or underdosing of the medication. These are all can definitely lead to the sugars going high. So when the sugars go high, they create a pattern within the system itself. So this part, coming to the second part of your question, what happens when the sugars go very high? So the simple phenomenon that takes place within the system is oxidative stress. This is the actually pathological basis for all from the inside the vessels that get damaged, because when oxidative stress happens, there's a release of free oxygen radicals. They are isotopes. They are erratic. They are very dangerous in terms that they start scavenging the internal part of your blood vessels. And when they do that, because they cannot stay single, they need somebody. So they scavenge the cells to get another isotope from there. So when they do that, in that, the endothelium is damaged. Then the cholesterol gets deposited into that. And that's why these arteries get choked, blocked. So that is the reason you get retinopathy, nephropathy, and neuropathy. This is what the internal damage happens when there's too much of oxidative stress. Now coming to the other part of, you said that what is insulin shock? There is no such terminology as such, but there are two extreme conditions by which we need to remember. If the sugar is going very high, for instance, if it goes above 350 plus, and when your ketones are coming positive, then you can land into a state called as diabetic ketoacidosis. This can land you into coma if untracked. The other part is prolonged hypoglycemia. If your sugars have been remaining less than 60 milligram per DL for long hours, more than 2 to 3 hours beyond, and then that's an irreversible coma which the patient get into. So you need to be careful of both these situations.
All right, so that's very important to know, all these factors, especially when managing diabetes. We'll slip into a short break now and come back with more questions for the doctors. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're discussing diabetes management and many important factors that one should be aware of in managing the disease. Let's go across to our doctors. And Dr. Thulasi, mucormycosis is a rare but deadly fungal infection that most commonly affects people with diabetes, especially we saw this after, the COVID pandemic. Why does diabetes cause mucormycosis and can we prevent it?
Yes, mucormycosis, also popularly known as black fungus, which became more prevalent during the COVID-19 pandemic, which is more common in diabetic, and it can be fatal because I'll explain you why. Like any organism, black fungus needs energy to survive. So its energy comes from glucose and acidic environment. So what happens in diabetic people, if their sugar level is not under control, this particular high blood sugar gets converted into ketones, which are acids. So having high glucose in acidic environment gives a perfect platform for this black fungus to survive and cause infections in orbits, sinuses, brain, lungs, etc. So it can lead to fatal infection, as I mentioned earlier. So the only solution and the simpler solution would be to have a tight control of your blood sugar level. And recently, a study has proven that adding an anti-cholesterol drug called statins to your treatment of diabetes will prevent the infection of mucormycosis happening in diabetic people as well.
All right, we have time for one final quick question. And Dr. Moazam, diabetes comes with a number of complications, and can diabetes affect a person's memory as well?
Yeah, it does, but it's only on a short-term basis. If you look at what we call as a condition as near hypoglycemic stage, wherein the sugars are dropping from say around 70 milligram per DL and going down to 60, then the symptoms at that time, the patient may behave in terms that he will talk little irrelevantly, or he may miss words while he's talking, and his body may start turning cold and clampy. And there will be sweats, like, when you take a bottle from the fridge, you get the cold droplets. Those sort of droplets will be seen in the body. So that's an indication to understand that this patient is going into hypoglycemia, and that is a short-term memory effect. Long-term, there are not many documented studies to suggest that, yes, of course, because of the long duration of diabetes, there is a condition that has been mentioned called as vascular dementia. As I told you, because of the oxidative stress, the endothelium of the blood vessels getting damaged, so it also happens within the brain. So that could be one of the reasons, but it's only very chronic in nature unless and until the sugars have not been kept, the HbA1c has not been brought to 7.5 and less than that for a prolonged period of time, maybe 5 years and 10 years, and I'm sure then there is a possibility, because there's not been much studies on that front. But it's a good question all the way.
All right. Well, we're completely out of time. Thank you so much, doctors, for joining us on the program and answering all those questions and very important information about the management of diabetes. Thank you all for watching at home. Goodbye.